Well, today, I get to interview a friend of mine as part of our Local Heroes series that we've been running, where we are visiting with people across Jefferson County and Adams County who really have gone above and beyond the call of duty in dealing with this virus that we've all been facing since early this year. And I'm meeting, our visit today is with Dr. Mark Johnson. So his job is as the head of Jeffco Public Health. So regardless, he would have to be dealing with this epidemic that we're facing. But in my opinion, he has been just such a tireless defender and hero of all of us in dealing with this very nasty and pernicious virus. So, beyond that, he has to deal with all sorts of other public health issues here in Jefferson County. And I just want to take the time to visit with him. He's participated in a half dozen or more telephone town halls with people in the 7th Congressional District to help them understand the virus better and the steps that were being taken to try to minimize the health effects of the virus. So, Dr. Mark Johnson, it's good to have you as part of our Local Heroes series. And I know you don't consider yourself to be a hero, but I can tell you, for many of us here in Jefferson County, we're really glad that you're the head of the Jeffco Public Health Department, and we think of you as a hero. So, Mark, tell us a little bit of the things you've been working on lately.
Thank you, Representative Perlmutter. Those are very kind words, and I really appreciate it. As you said, I do not consider myself a hero. I really see the heroes are the ones on the front line, whether they're first responders or law enforcement or the physicians and nurses in the hospital. But we have been very busy in public health. I think the issue as it arose as a novel virus, something we had never seen before, really caught all of us not really off guard. We've been training and planning and working for something similar to this for 20 years at least, looking at plans, looking at what we would do to respond. I think the thing that sort of caught us off guard was the fact that we had really trained and been prepared for something that was going to hit in Colorado or Jefferson County, and how would we respond. And when it hit worldwide, it both overwhelmed the world's ability to respond to it with the lack of personal protective equipment and other issues that were worldwide instead of just focused on Jefferson County, such as reaching out to FEMA or CDC or others. We had always sort of hoped they would be there to back us up, and now they are swamped with every county in the United States asking for them to help. And so we really had to pull within ourselves with our department, and I think it really helped that we had built a good relationship with all of the other public health departments and public health directors in the Denver metro area, so that we really had a bit of a brain trust, or at least we could get together and commiserate a little bit about the issues that all of us were facing. And that has been really helpful as we have looked at how do we respond with needs for personal protective equipment, how do we respond for looking at public health orders. All of those things really have been made much easier, if that's the right word, at least we had more ability to deal with that because we were doing it together. I think, again, I don't see myself as being a hero. I see myself as being perhaps a leader of heroes because of the way both our medical teams in Jefferson County, our healthcare systems in Jefferson County, and our department here have responded to something that is unprecedented and really unknown before early February or early March.
Tell us about some of the teams and who are the people that are in your department? Do you have doctors? Do you have nurses? Do you have statisticians? I don't know how many people are in your department or who's there. Tell us about some of them.
Yeah, I'm the only physician in our department, but we have a large number of nurses. We have several epidemiologists, statisticians, and we have a number of planners who have been both planning for emergency preparedness planning as well as planning for our strategic planning that have been pulled into doing things with this. And then we have a number of, usually they're restaurant inspectors, but we've had to pull them into helping us with compliance issues around the requirements of the first stay-at-home order and now the safer-at-home order, working with our businesses, working with our community, working with schools and others to both understand what the compliance issues are and help them to get into compliance. And then we have a whole logistics team that works with our finance team to make sure we have the funding necessary and reaching out to try to find every source of particularly gloves and masks and other protective equipment for both our staff and the hospitals in our county, as well as nursing homes in our county, long-term care centers in our county. And we've learned about other people that we really didn't even have on our radar list, a number of private home health care, not really agencies, but have been designated under Medicaid to be caregivers for a number of individuals. And they were having a difficult time finding personal protective equipment, and dentists were having trouble. So we have a logistics team that is working on that, as well as our overall planning and data collection, our epidemiology group, trying to keep on top of what are we learning about this disease, how is it being transmitted, how does that impact what we're doing here, how does that impact the way physicians work in the hospital or in their own clinics, all of that we've had a bit of input into, as well as working closely with the school district. I think the school district, if we have a difficult job, they have a difficult job times 10, trying to figure out what is the best and safest way to get back to school, because we truly know that health is impacted by more than just medical care. It's impacted by the economy, it's impacted by education. And so we've been working closely with our business community and with our school district, all of those, to try to see how do we decrease the negative consequences of this disease.
How long have you been with the department?
I have been here 30 years, at least 30 years and 4 months, but who's counting?
And how many days?
Yeah.
Well, so what other kinds of things do you often work on? I mean, obviously this has taken pretty much all your time. It's that massive and that unknown, but I assume there were other things that you were doing that you still have to do.
Yes, just because we have an epidemic does not mean we don't also have, like yesterday we found out, or the day before we found out, we have plague in squirrels. And so trying to keep all of that going, as well as making sure that the restaurants, as they do begin to open up, are safe, and those kinds of things did not quit. We also have a number of individuals who rely on, particularly our nursing staff, with home health issues. We have a nurse home visitation programs. We have several of those, and they now no longer can visit folks at home. So they had to figure out a new way of communicating. In our clinics, we had to figure out a new way of getting medications and other supplies to our clients. We have a program that works with folks who are addicted to drugs, who need clean needles and clean works, those kinds of things. We had to figure out a way to get those to them, even though our building is closed. So there were a number of logistical issues to try to deal with those sorts of sort of emergent issues. We also have a number of grants that we've accepted that have scopes of work and deliverables that we have to deliver for the money that we're getting. We tried to work with the state health department and with the federal grantors to make sure that we didn't lose our funding, even though we had to sort of pull some of our staff away from those programs to focus more on what we're doing around COVID-19. So just kind of juggling all of that with the finances and the deliverables and all of that has really been an addition to a full-time job. Most of our staff have been working from at home. I have a 5-year-old granddaughter who lives at home with me, and I found that I could not work at home. So I've basically been coming into the office even when the building was closed. So for about 80 some days in a row, I was in here, usually quite long days, trying to juggle all of those kinds of things that I just mentioned and make sure that we were still meeting the needs of what was slowly unveiling itself as a new disease and how we were going to deal with that.
So in this, in the last 80, 90, 120 days, as this thing has come rolling across the world, has there been anything that has, a couple questions, anything that has completely surprised you in terms of the disease, and anything where you've seen people going above and beyond the call of duty where you think they were local heroes? You mentioned the firefighters and the first responders and law enforcement, but I'll let you sort of talk about local heroes because you've been on the front lines of this thing too. So anything surprising about this disease? And then tell us a little bit about some folks who you've seen go above and beyond the call of duty.
I think it's not like something jumped out as a surprise, but as a brand new virus, everything about it was new and sort of surprising. And some of the information that we had at the beginning that we were getting from places like China and Italy and France and other places that were hit first turned out to be not true. And so we based a number of policies and approaches to the idea that this disease does not spread from people who aren't showing symptoms, that there is no asymptomatic spread. So it was much easier to sort of plan on how do you control this disease if the only way it was spread was from people who were already symptomatic, that had cough and fever and shortness of breath and those kinds of things. It's much easier to focus in on them. Once we learned, however, that this was being spread probably more by people who were asymptomatic or from children or others that did not seem to have any symptoms at all, that totally changed the way we had to respond, the way we had to put plans in place. So all of those kinds of things were rather discouraging, actually, at times, trying to totally change the way we were responding to things. Also, we had some surprises working with some of our colleagues, that keeping as closely in touch with the state health department and the governor's office as to what was going on. We attempted to do that, as I mentioned earlier. We worked closely with the other local public health agencies in the Denver metro region, but quite often we would be surprised by new public health orders that were coming out either from the governor or the state health department. And then we would have to back up with all of the ones we were working with and tell them, here's how things are changing. We didn't know this was going to happen. And so just making sure that we had good communications, trying to keep in front of that, brought a lot of surprises to us. We actually had worked closely to put together a stay-at-home order for the Denver metro region. And then the day before it was supposed to come out, we learned that the governor now had a new plan for that. So we had to scramble to meet all of those requirements. So there have been a lot of surprises as everybody's been trying to do what they think is best for responding to this. As far as some of the heroes, I think, we have called many of our staff in our health department, as well as from the police department or the sheriff's department and others, to get out of their comfort zones and to move into areas that they really had no experience in, as far as responding from the emergency operations center, nurses taking over logistics and taking over certain other areas that they really had not ever been trained in and had not practiced. Right after 9/11, we did a lot of training and had sort of gotten a little bit off the track. We did have an incident management team that continued to work, but for many of our staff, learning the whole incident command schedule and how that works was brand new. So that was, I would see them as heroes, being willing to move over and do things that they were not used to doing or had never done before. I think our incident commander, Christine Billings, is probably one of the heroes of our department, and the way she's been able to pull our teams together, to pull the planners together, to pull all of the different, logistics and finance and clinical and all of those together. She is somebody that I think would be good for you to interview. She's done an excellent job.
I will do that. So through all of this, what would you like to share with the folks in Jeffco and Adams? I know Adams is not part of your territory, but you're talking to people in Adams through this interview. And you've been talking to them when we've done the telephone town halls. And John Douglas, likewise has been speaking to folks in Jeffco when we've had him on those calls. So what would you like to say to all of these folks as part of this interview?
I think what I would like the residents of both Adams and Jefferson County to know is that even with all of the hard work that is being put in by our healthcare systems, our physicians, our nurses, our local health departments, our law enforcement, first responders, in spite of all of the work we are doing, none of that would be successful if we didn't have residents who were compliant and who were knowledgeable about what is going on. The fact that we were able in Colorado to fairly quickly flatten the curve and to make real progress as far as decreasing the number of cases that we had and the number of hospitalizations that we had and getting people off of ventilators, all of that really began by the fact that residents got educated as to what was necessary. They were compliant with the stay-at-home order, even when we extended it for 2 weeks, although there was a lot of complaining here in the Denver metro region. We have good evidence from some of the data that watches where smartphones go, that people were staying home better and were doing what was asked of them. And because of that, we really did see a tremendous decrease in the number of cases. Unfortunately, as we began to open up a bit, people then, I think quarantine fatigue wore on all of us. And I think people started saying, okay, we flattened the curve, now we can get back to normal. And unfortunately, now we're beginning to see some spikes again, particularly here in the Denver metro region. But again, the only way we can respond to that is by having our residents understand what we're asking of them. We're talking about a mask mandate now that will be pretty much all around the Denver metro region. Understanding why we're doing that and complying with that will be the greatest help that we can ask for from folks to really continue to comply with what we're asking. We're happy to answer questions that you may have so that you understand better why we're asking certain things. But we truly do believe the only way we're going to get ahead of this is if we as a society, with our social contract with each other, work together and comply with what is necessary. And thank you for what you've done so far, but there's still going to be some heavy lifting as we move forward.
I really appreciate that. I think, we made heck of a good progress. There's been some backsliding. I don't know exactly, some new spikes. We don't see what some other states are facing right now, but if we don't mind our P's and Q's, we could. And I think that's really the thing that has impressed me about Colorado generally is everybody was serious about this, and most people still are serious. There are some who, are just have had enough, but I think even they are starting to get the picture again. And none of us likes wearing a mask. I mean, none of us likes to be socially distant, and because we're social creatures. You talked about a social contract. Americans, humans, are social creatures, and but people are taking this seriously. I think we've been able to do some good work, and I think I really want to applaud you for your willingness to be accessible, whether it's through the telephone town halls or the different kinds of information you're putting out to the community. that communication is key to people accepting and understanding some of the restrictions and defenses we have to put into place to fight this darn thing. And it's not going away, but we're making progress on vaccines. We're making progress on therapeutics. There have been some technological advances in construction techniques with HVAC systems and lighting systems, but it's still going to take all of us working together to bring, to continue to keep the hospitalizations and the death counts down. So this has been a task I doubt that you wanted to undertake, even though it's sort of, in your department. But as you said at the beginning, you were expecting something that might break out in Jeffco or one of our cities or the metro area, not everywhere at the same time. And that's been a whole other problem to have to confront. So, Dr. Mark Johnson, thank you for being one of our heroes. And I know you don't think you are, you're just doing your job, but I think you're doing it well. And I think you have gone above and beyond the call of duty to help us here in the Denver metro area, Jefferson County especially. So any parting thoughts, please, the floor is yours.
I think the last thought I would share is, and people understand this, but we all have different opinions, but we're not enemies. The virus is the enemy. We need to figure out how do we work together, even with our different feelings as to what's going on with this. How do we work together? How do we become more educated? And how do we defeat the virus instead of fighting each other across the aisles?
Well, I thank you. And, we're working on that. We've done a pretty good job in the Congress. We're kind of hit some stumbling blocks, but I think we'll get things moving forward to provide more resources to men and women on the front lines, men and women in public health departments, men and women in our school districts, and to provide for safer environments for our students and others. So go ahead.
I would be remiss if I did not thank you and Congress and the President for the money that has come down to help us at the county level and at the public health department level. We never could have done this without the support that we have gotten from you, the financial support as well as the moral support. But thank you very much.
Well, that's part of the social contract you talked about. So when we demand of the public that they do some things that ordinarily they wouldn't do, we've got to be responsive to help in that regard, recognizing that the contract is two ways. And so thank you for recognizing that. And thank you for being one of our local heroes, Dr. Mark Johnson. See ya.
Bye-bye.
Bye-bye.